So what's a preservation rhinoplasty? This is a relatively new concept in nose surgery, which uses minimal dissection techniques to reshape the nose and helps to maintain the structure and the function without removal of tissue. So here's just one example of what's called a dorsal preservation technique, where we are reducing the dorsal hump by just lowering it, and this is called a push down technique. So no bone's been removed, no cartilage has been removed, but the whole bridge line has been pushed down into the nasal cavity without even elevating or undermining the skin. So what these techniques achieve is maintenance of the structures, and this provides long-term stability and maintains the function of the nose as well, in terms of the airflow and the airway. So the advantages of preservation rhinoplasty are quite significant compared to traditional rhinoplasty procedures, and so one can summarize them really in terms of: one, it's a minimal technique, so it enhances the overall recovery with less bruising and swelling. Secondly, because no tissue is removed, it helps prevent long-term contracture and collapse of the tissues. And then thirdly, because a lot of the cartilage framework of the nose maintains the airflow, if we maintain the structure and integrity of these cartilages without removing them, one has a better overall chance in maintaining the function of the nose in terms of breathing. So a number of very, very important advantages of this technique.